this hospital management system will give the technology. We can sort out this entire issue and the patient history, and we can diagnose the uh, uh, complications. We can treatment. We can give them a treatment. We can give this meditations. Everything we have to talk about this. But main prime thing is we have the gap for doctors and the patient. Apart from disease and new complication things will go into awareness, lack of awareness. This is what we have to convey. Many use cases available. We have to take it the major use cases for the startup. These are the problems we are seeing. So the startup founders, we are looking for this many prevention aspects, or else after complication we have the recovering things. Each and everything is India's, not only world most important industry as healthcare industry. Industry innovations. This is we have the in this journey around this long term journey. We have the prevent. Now this technologies, emerging technologies, we have to implement it through this healthcare industry. Like this digital tune, we can this we don't operate before that. We can able to diagnose. We can able to treat. We can able to make a clarity to this patient and the other co-doctors. We can able to predicate before we can entire aspects we can this pre-plan we can work without surgery. So digital tune technologies is most impacted in the healthcare industry. So technology on one point of side is a technology emerging, and other side of say lag of this awareness in this industry. So what we try to say, the emerging technology we have to adopt this industry. We make innovations and stage by stage problem. We have to nurture the ideas. After this, we have this MVP. MVP is a minimum viable product. Like we have to diagnosing ring. We have to find out there's not the find out the ring now. How the rings going to find out this blood circulations and this apart from many complications, we're going to we're going to find out this before, and we can able to diagnose, we can able to treat, we can able to maintain. This is what the current scenario will going to happen in the healthcare industry. So startup is nothing but is first we should understand as a founder startups what is mean by this entrepreneurship. Entrepreneurship is nothing but it is making the uh, solution for the problem. This is a one problem we have to make this a solution. This is a entrepreneurship. This is a smart core and business. What is it? We are making a trading business called that is a business. Apart from what is a startup? Startup we will go into this and make this a innovation. Innovation when going to implement it. Now this is what the startup innovations where is a playing for this role as a technology as what do you say this technology emerging technology like artificial intelligence and this physical AI. Apart from emerging technology, cyber security, blockchain. Apart from digital tool like this emerging technology, when going to adapt this each sectors, each domain like this patient history predications. When going to use the artificial intelligence, it's a generative AI when going to majorly playing for this document writing. There's a summary making and problem statements and find out the solutions and documentations will going to make a simplifying this industry. It is a much complication when going to make a file and this follow. It take more many complications for this doctors apart from this co-worker of this hospitals and patients history when going to uh, take it's a much challenges of this in the industry. So it's all going to make a simplify in this generative AI. Apart from this, physical AI is a robotical surgery, surgicals. Apart from this, medical devices, apart from digital twins, so many technologies will going to play this role in this when going to prevent the statistical data analyticals, each and everything will going to make a sense in this industry. So as a startup, when going to talk about this healthcare industry and startup, how are we going to start a startups? We have to find this one problem and with this make the solutions, and it will take it as a trial and error projects, and there's a pilot project or the prototype, pilot projects and MVP, and the go to market strategy. Apart from this real time use case, as a different problem facing in this current hospital industry, a different problem facing this diagnostic sectors and telemedicines. Apart from this rural, apart from this banking, say BFSI, banking, finance, and insurance industries is facing different claim issues. So entire ecosystem we have to make it make the great solution uh, in this startup. That is what we are talking about this startup healthcare industry. How we're going to make this is simple things. We just find a problem. For example, patient is a very challengeable risk. So we make a small clinic, and patient is maintaining is a very challengeable things. We make it this a file. We have the create own LLM, own large language model, and like a specialties like DGO, DCH, orthopedic. Based on the sector, we can maintain this data on the patient history. Once is a patient will come this after 6 months, 1 year, we can find out this what is the past complication, what is the present complication. We can able to prescribe and predicate this futuristic complication. So many things we can able to now address the problems in this one point of view. That is what is playing this startup and technology. This is what we're going to take it advantage in this Medverse Academy. Apart from some Medverse events, what we're going to talk about this things. We have this start this innovation healthcare. Your idea, your innovations, your startup will going to launch our this upcoming Midwest 2026 September 26 27 will going to happen in the Salem Varalakshmi Mall. We have this many great opportunity in this event. So you are the aspiring startup founders as a existing startups, as a current startups will going to take. This is a platform of emerging technology, upcoming this empowering this tier two plus startup ecosystem. This is a great platform to creating this Medverse organizing team. So we have to utilize the right platform in this current uh, in the rest of the Tamil Nadu, apart from South India, we have the welcoming to all over India for this innovation ideas. You have to pitch it here. We have the recognizing as per the certificate and this prize. Apart from we have give this investors connected and the startup TN. We have the associate entrepreneurship development institution of India, and so many investors we have the associated in this event. So this is the right opportunity, right platform to we have to launch our innovation ideas in the healthcare ecosystem. This is what we welcoming to all over the new innovations. Apart from just I have to overlook in this joining this our aspiring startup founders, how we going to launch. We have the give the guidelines how to we have idea to IPO. We can launch our ideas like in the scratch. Your idea will make this a MVP. The minimum viable product will going to test. Apart from we have to take it a go to market strategy. We have the supporting for this go to market strategy. Apart from we are real-time business and real-time commercialization, we're going to support funding opportunity like initial funding, the innovation voucher fund up to 3 to 7 lakhs in the entrepreneurship development. Apart from so many incubations, and investment institutions will going to support this innovation startups. Apart from seed funds, the corporate social responsibility is healthcare industry is playing more vital role in this sector. So your innovation will going to make impact. We associate the corporate social responsibility fund. Apart from we have the ventures, we going to launch global startups. So many opportunity. This is the right platform to utilize the right thing. Other we have the it's not a slide. It's just we have the highlighting small things. We are going to take this. This slide is showing AI plus healthcare industry. Why we have to go for this? Uh, like artificial intelligence, emerging technology, artificial intelligence is minimalize the time and work. It is going to help the month of time we have to make it the simple of the minute of the thing. This is the right time we have to emerging new startups as in the all the vertical we were welcoming to this your innovations in the healthcare entire healthcare ecosystem. It may be this, patient communication, medical documentation is much easier than before. It is like this I told about before the large language model. We can create own LLM, SLM in our own clinic. It's a small size, it's a specialty and specialty hospitals. We can make this own LLM. We have to train the our practice knowledge, experience, and the complications, and we have to make a conversational AI, apart from this chatbot, apart from the CRM, so many artificial intelligence will make a cost effective and time consuming, the accuracy, apart from this patient satisfaction. So many things the artificial intelligence going to address. This is the time to ask questions, and we have to add many more things in the upcoming the things. This is the time. Anyone, if you have the query regarding the startup funding, innovations, anything else? Hello, excuse me. We have to continue the session as effectively. Is when going to make a conversations based on question, I can able to address the things. It's a nurture better. It's not a one-way communication. It's not just like this webinar on going to. It's not education session as well. Also, we have to make a sense. Anyone, any query, team Ari?
Sir, I have one doubt, sir.
Yes, உங்க பேர் சொல்லுங்க, introduce பண்ணிக்கங்க.
Sir, myself, Dr. Mainyanam. I am working as an assistant professor and head in BBA, Arulmiga Adanariswara Arts in Tiruchengodu, sir.
Great, sir. Thank you very much, sir.
Sir, I just joined through the WhatsApp link
Great.
from Prabakar. Yes, yes. Sir, I have a doubt. If you want to start startup in colleges, what we do, sir?
Sir, you have the idea, you have to pitch, and we have to give the solution. Now we are mentoring these startups. How we going to we are the first to validate the idea. It is going to how much market opportunity we have, how much scope is there. First is the we have to study the segmentation apart from this market opportunity. Then only we take the idea. Then we have to support the entire idea to IPO. We can able to guide as the company legal permission, tech enablement, funding support, execution strategy. Apart from this, business real-time commercialization, each entire ecosystem platforms we are running. So we happy to help you. If you have the idea, we have to validate this first. It's the idea will going to work out it. We don't take 1 or 2 years, and after that, its ideas not work like that. We don't say. So happy to, as a professor, we are the nurturing many ideas. If you give the idea, we can able to immediately validate, and it's really validate the idea. We have to support for this initial minimum viable product. If you start minimum viable product, we can able to proof of concept. We take it to see investors apart from this innovation center. Then it's make a fine tune. Then we'll have to entire idea to IPO we can get, sir. Thanks for your valuable questions. Anything? Let me
Thank you, sir.
clarify, sir. It's enough, or you have to say additionally if you have any apart from this.
Hello, sir. Dr. Arun, sir. Thank you for a wonderful presentation, sir. I just want to add one more point to that, what Prabakar sir is telling. So basically, it is not startup only for colleges or only for hospitals and things like that. It's a global startup is global. Okay, because of invention of AI, it is we can take it anywhere in the world. We can do anything sitting from here, even if it is a tier two, tier three, it doesn't matter. You sit in a village, we can take it globally. So that is what is the whole idea is. So we need to find out what the problem is. That's the first question. What is the problem that the doctors are facing, or the healthcare is facing, or the college is facing? Whatever that, how can you solve that? Whether you use AI, whether you use a device, whether you use something else, XYZ doesn't matter. So that is what a startup means. So it is not basically how you are going to do this and that. So how are you going to solve a problem? So that problem is where we start an idea. So that idea is starts from the problem, and once that problem is, when you can answer that problem, that becomes a startup. So that is what I wanted to add. So in the era of AI, it is becoming very easy and easy. It is becoming easier and it is becoming faster as well. So let's say when from the doctor's perspective, if I have to spend lots of time writing patient notes, okay, instead of that, if I have a transcribing system where I can transcribe and then it comes through AI and it gets printed within 1 or 2 minutes, where I have to sit and write the whole notes, which takes literally 20 minutes of my time. So I'm not effectively using my time. So that is the problem that we are facing. So this, if you can solve this problem, that becomes a start. So just put it into a medical perspective. Sorry to do this. You want to add anything, sir?
Great, sir. Thanks for valuable insights, sir. Thank you very much, sir. Arun, sir. Apart from any queries you can ask. This as a students, many students are going to join. Students aspect, you see the slide. This is a one such a problem solution as a innovation founders. Anyone can, as a students, your point of view. It's not the slide. We have to make a sense. We have to discuss on real solution. That is what this webinar's ultimate purpose. Anyone? Thanks for valuable, sir. Okay, sir. As a student, this is a idea to startups. Some points we are giving for this one. What already we discussed regarding this one. Just we have the seen in the slide. This is a startup. Some roadmap. We have some strategy. This is will going to scale our new startup. Anything? Any funding related, scalable, pilot, MVP solution. Any questions regarding startup and innovations and tech?
Hi, sir.
Hi, introduce பண்ணிக்கங்களா just
Myself, Ahmida. I am an engineering student, second year.
great. From which college?
Narasu Sarathi,
Oh,
Institute of
great.
Technology.
Okay, fine. You are your questions continue. சொல்லுங்க உங்களோட போய்.
I have a startup idea about Uber for CPR.
Okay.
If a person suddenly suffers from a cardiac arrest on the road,
Okay.
an ambulance is called, but it may take several minutes to arrive. In cardiac arrest, every minute matters.
Got it.
So, what if there was some trained CPR just a few minutes away? So, I want to introduce an app for it.
Okay, great.
My startup solved the problem through a hyper local citizen
Okay.
first responder network.
Okay.
So, I named it as Uber for CPR. When emergency occurred, our system identify nearby verified CPR trained volunteers and alerts them. The closest available responder can reach the victim before the ambulance arrives and start CPR or use a nearby AED.
Okay.
This is my
Great.
idea, sir. And
Great
please,
idea. It's a great solutions before ambulance. It's a challenging one. Okay, it's a great concept. What I'm saying, if you have find any competitor, this idea, you have to find this your startup competitor.
no, sir. It's um,
Yeah, okay, good. Thing is, your problems is looking this problems suddenly came cardiac arrest, which means now the ambulance coming late, and we have the gadgets. Apart from this, we have the creating some first aid, like it's a first aid alert information right now.
yes, sir.
First aid alert information. So who is going to this addressing on the uh, uh, surrounding area? Who is uh, who will go into the first aid will go into?
So the nearby persons who are seeing it, they don't know CPR. No, that persons can share the location in the app.
Okay, got it.
The alert will go to the trained CPR who are nearby to the location.
Okay,
They
it's
can use
everything
the
okay. It's the thing is the alert created where they go, and this it's a trained people or is untrained. Who will go into
trained people.
trained people? Okay,
Trained people can register in that app, sir. They
okay,
can
okay.
get the alert notification in that.
Okay, it's healthcare, cardiac arrest, and in physically how what they going to do? How going to the take care of
Sorry,
them?
sir. Can I answer, sir? Sorry,
Yeah,
sir.
sure, sure. Yeah.
Sure. So that's a wonderful idea. So it is actually very good. So what you're telling is that there will be an IAD external a defibrillator, and a person who is already well versed with CPR, they'll start CPR. It's a very good idea. So as Prashant has identified, how can we get revenue out of it? So first thing is we need to do education. So in this startup that in your model of startup, you have to educate people who will be learning this. Okay, especially traffic police people or drivers and people like that. We have to educate these people so that they become your counterparts in the business. Okay,
Okay.
so yes, you can do this as a scalable product, but when we develop this into a full blown product, I think governments will come and join with us, I suppose. So it can be with when it comes with 108 or because so 108 today 108 is coming immediately within 10 to 15 minutes. Okay, and if there are lots of ambulances that are available, and if you have to come faster than an ambulance, we need lot of people who are well versed with that. So that's the difficult part. But if is it doable? Yes, it is doable. It's a good idea, and we need to we need to work on it. We need to pilot this and develop a product. I think it's a very good idea.
I did great, sir. That's what I'm
Yes.
saying. We are what we think. Who is the competitor already playing the major role, and we have to find out the competitor. Then we have to give the problem solution. Thing is, ideas are good. When come to as a real practically, it is going to CSR project. It's a social cost project. Apart from this, so many things in the startup valley. Great idea. We have to work out. Thanks for great insights, Ma. We all connected. Saradi, we will discuss after the sessions. Thanks, great idea. I will guide how going to take it forward. Thanks for all available insights, sir, Arun sir.
Thank you, sir. Thank you so much.
Thank you, Ramesh. We have to nurture and develop these things.
If you want to continue, sir.
Yeah, I will continue. Next.
Continue.
Yes. Okay, next, any questions, any new startups? Like sectors, we have this, the insurance professions are many challenging after the claim and settlements. Apart from this, is so many departments in this healthcare industry. Not only one industry is going to play. Many departments involving. So if one department is going to file, we will take this as challenges. That is what still we are facing many challenges. Any new startup ideas? Anything? I appreciate Saradi College Innovations. We will work on next. Hello, Ari? Ari is there? Sir, any questions?
Presentation முடிச்சிட்டீங்களா சார்?
Session is just a general session, sir.
Okay.
We'll
We'll give another 5 more minutes for people to drop in their questions in the chat box. If they have any questions, any ideas, we'll give 5 to 10 minutes for the people to drop in their this thing. So meanwhile, I like to share a screen. Are you able to see my screen?
Yes, sir. Not right now.
Are you able to see the screen now?
Yeah, we can.
Okay, good. So, welcome to the world of Metaverse. So, I want to tell you what is Metaverse basically. So, it is basically medical universe we are bringing it together to form Metaverse. So, we are bringing it Metaverse for the second time to Salem. So, this is South India's most actionable healthcare summit. What is going to happen in Metaverse? So, there are 4 things. One is Med Talks, second is Med Pitch, third is Oscars of Healthcare, and the fourth one is the Medverse Expo. So, Med Talks is basically the business of healthcare that nobody taught you in medical school. So, what we're going to do here is, we know as doctors, we know how to treat a patient, how to talk to patients, but we don't know how the business of healthcare happens. That is what we are going to discuss in medical talks or med talks. So coming to what we have done last year. So this is, as I told you, this is the second edition that we're doing in Salem. So first edition, we had 120 plus stalls, which includes pharma companies, their devices, technologies, and various equipments, manufacturers, dealers, and distributors were there and exhibiting their products from all over the country, which was attended by 3,500 plus doctors all around South India. And there was almost 5,000 plus total visitors, which included most of them are doctors, 3,500, following by healthcare professionals, hospital owners, and other people. So now, what is going to happen in Medverse 2026? It is getting bigger, bolder, and better. So now we are expecting around 200 plus stalls. We are going to see 7,000 plus doctors, which we are expecting, and over total of 10,000 plus visitors over a period of 2 days. And we are going to bring in more than 100 plus startups in MedPitch. I'll be talking in detail about what is MedPitch is. So now MedTalks. Today we are in, we are in the road to MedTalks. This webinar is a part of MedTalks. So what is basically is MedTalks is we're going to talk about what exactly is not taught in medical school at the business of healthcare. So we are going to, the theme of the conference is 3F, which is funnel, funding, and future. Funnel is basically how to acquire, how a patient acquisition is to be done, how to retain a patient, how to make them pleased, or how to make the patient or our customers happy. So that is what are the strategies for acquisition, admission, and repeated care to hospitals. So next is funding. So that is where insights into raising capital, structuring, and deploying funds for hospital expansion and other things will be discussed in funding. And in the future, how to use AI. So AI is not future, AI is today. So we are going to explore how technology can be initiated in hospital or healthcare business, and what is going to be shaping this healthcare business for the next 5 years is what we are going to be discussing in the Med Talks under the conference theme of 3F: funnel, funding, and future. So now coming to Med Pitch, that is what we've been talking for the past 45 minutes. So this is basically 100 plus startups are going to come register, and they will be curated through a rigorous hackathon process. Due diligence will be done to these startups, and then top 25 of them will be chosen to come and present their work, whether it is software, whether it is technology, whether it is a device, or something else. So they'll be pitching their ideas, where two things are going to happen. One, a doctor will validate your idea, a scientific validation of your product. Because so most of the times what happens is startup founders sit in a room and develop a product which might not be completely helpful. There are lots of startups who have failed in that stage where they don't receive a scientific validation. That is exactly what we are going to do in Medverse. So that is the most important point. So get validated whether your product is scientifically right or wrong, whether all the compliances is met, HIPAA compliance, and other compliances are met, and how you can improve your product. And then investors are there to invest on your product, invest on your software or whatever your startup is. And then top 3 of those startups will be awarded, and you can directly pitch in front of the hospital owners who are your clients. So you are bringing a healthcare product, and so where we are going to validate it, we are going to give you funding, and you're going to meet your clients as well. So we are three ways it is useful for you as a startup. And this is the most interesting part of the event. So we have something called as Oscars of Healthcare. So we are bringing the Oscars to Salem. So this is specifically for healthcare. So we have 27 award categories, including 5 award categories for healthcare startups. If you have a healthcare startup idea, please do nominate yourself or your company. Go to the website. I think Prabakar will drop in the links for all the registrations and nomination forms. So we are in association with IMA Salem, who we have branded as the official medical patron. So we are going to recognize individual doctors, hospital owners, institutions, startups, marketing people, and all healthcare leaders all across South India. So this award night comes with a networking dinner, so which is going to be attended by all the hospital owners or the doctors who are going to build the present and the future of healthcare. So this is going to happen on the 26th night at Sri Varalakshmi Mahal, Salem. So registrations are open now. So this is the registrations. So this is very meager amount when you compare to how much we are going to make, how much networking you are going to do in those 2 days. So please do register yourself fast. So come see us, be a part of something big. So this is Medverse 2026, South India's most actionable healthcare summit. This year it is getting bigger, bolder, and more impactful than ever. You can attend as a delegate. You can book a stall in the expo. You can pitch in the Med pitch and nominate your startups or doctors. If there are doctors in the audience, so please do nominate yourself for clinical excellence and other categories of awards. You can see everything in our website, which is medverse.co.in. So thank you so much. See you soon in September 26th and 27th or at Sri Varalakshmi Mahal, Salem. Thank you so much. Thank you so much, sir. I think if there is any questions, we will take.
Thank you very much, sir. Any questions, any clarity? The innovation will going to launch our startup. Sardi College Innovations, they're saying now. We have to nurture and develop, and we're going to launch in this upcoming our startup arena. Your good name, ma? Okay, thanks for your giving your time, and we happy to associate with you. We welcome these innovations. Once again, thanks to Medverse team. We organizing a great event. We have to utilize all those things in this our innovation in and around. So I'm very happy to associate this event. We have to make a great impact. This is a time to show our ability and talents and the innovations in this event. We are all happy to welcome you to all the innovation startups. And uh, doctor said all this the entire event showing this one. This is not just an event. This is a Medverse is making an impact in the society. Just not like that event. We are making the sense of this event as I say, knowledge sessions, panel discussions have entire 2 days. And apart from this, we recognize in and around of the Tamil Nadu, we are the healthcare industry as doctors, innovation leaders, and entire ecosystem. We are the recognizing and giving the award. Apart from this, we make this business stalls as the entire ecosystem. Apart from we are the network, interesting networking sessions as students, founders, investors, industry experts, and this apart from this entire ecosystem, we are the making the great sense of this event. We all are happy to welcome this all in this event. We make a sensible great success. In future, we will make this Salem will going to this healthcare hub. This is a witness of this event. Medverse, I'm saying again, Medverse is not just like this event. It is a medical core healthcare event. We are working behind this hard. We make this event as a great milestone. We're setting this as second edition. This is the first edition, great success. Second edition, bigger than that. So we welcome all the doctors and innovators, research scholars, everyone. Thanks for the opportunity. Thanks for your valuable time. Thank you very much. We will see in this event. Thanks. All the best. Anything else?
Thank you. Thank you so much for your wonderful presentation, sir. It was very informative. It was very good. Thank you so much. I think Bharat Kumaran, we will send you a WhatsApp link for registration as well. Thank you so much, Parashar. I think we will connect you through LinkedIn. You can also reach us on LinkedIn as well as in WhatsApp as well. Please do connect with us. We can travel longer. Thank you so much. Thank you. If there is no questions, we will end this session. We'll give another 1 or 2 minutes.
Yeah, thank you very much, sir. Question session. It's a time to reveal. It's no, don't hesitate. Any question?
No more questions, sir.
Okay, sir.
Okay. Thank you so much. Thank you so much. Thank you everyone for your spending us time for this webinar and making it very interactive. Thank you so much, Mahumida, for your wonderful idea as well. We can talk about this in detail. If you want to connect with us privately, we are happy to do it.
Thank
Me
you, sir.
or Prabakar sir, we can talk about it. Thank you so much. Thank you. And we have a link that is posted in the chat box. You can add. You can come to the community. You will get all the updates there about every webinar that is happening. So this is going to happen all around the year. So we will connect in the future events as well. Thank you so much. Thank you so much, sir.
Thank you very much, sir. Thanks for the
Yeah.
opportunity.